Jones, and I am the Vice President of Texas PSR and serve as the co-chair for our Eco Health Committee. And I should say, if everybody can just take a minute and just put your name in the chat box with where you're calling in from, might meet some new friends and some old friends. So before we get started, let me just take a couple of minutes to introduce Texas PSR to anyone who's joining us for the first time. Texas PSR works to protect human life from the gravest threats to health and survival. That includes through research, education, and advocacy. Our membership is geographically and professionally diverse, with members in major cities throughout the state, representing physicians, nurses, other healthcare physicians, such as myself, a medical anthropologist, along with students and concerned citizens. Our strategy for achieving positive change is to provide a conduit for the medical community to educate and inform the public and lawmakers about potential threats to public health through education, analysis, and expert testimony on a range of issues, including climate change, food systems, toxins, and nuclear weapons. So if you are interested, please follow up with us. We're happy to always invite new members so that we have robust membership and we can continue to advocate and outreach. So let me go ahead and introduce Dr. King. We are delighted that she's here. A little bit of background. She is an associate director in the Bullard Center for Environmental and Climate Justice at Texas Southern University. She works on interdisciplinary research projects for the Gulf Coast Equity Consortium, the Environmental Justice Data to Action Project, building civic engagement during COVID, and the Houston Multi-Hazard Information Hub project. Her work focuses on environmental justice projects designed to address community-identified environmental health center concerns in underserved people of color throughout Houston and in the Gulf Coast region. Dr. King's additional interests include the role of neighborhood effects in the onset of disease in underserved areas and organizational community capacity to address environmental and climate justice concerns. Dr. King has published extensively in a multitude of journals, including the American Journal of Public Health, Cancer, Health, and Place, Journal of Cancer Education, and the Journal of Air and Waste Management Association. She received her BS degree in chemistry from Texas Southern University, as well as an MS and PhD degree in environmental science toxicology from the University of Texas Health Sciences Center in Houston, School of Public Health. We are delighted that you're with us. So I'll now turn it over to you, Dr. King. This is your space. Thank you very much.
Thank you. Now I am going to share my screen. Okay. Okay, can everybody see my screen?
Yes.
Okay, perfect. So today I'm going to share about environmental justice and particularly what that looks like in Houston, Texas. So I'm going to talk to you a little bit about the work that we do in the Bullard Center, and much of that is done collaboratively with community-based organizations in the Houston area and along the Gulf Coast. I'm also going to share a historical context of environmental justice, and then I'm going to introduce really briefly some of the projects that we've worked on related to air quality, cancer cluster in Fifth Ward, and lead in drinking water here in the Houston area. So we are the Bullard Center. The center is named after Dr. Robert Bullard. We are housed at Texas Southern University. We are an HBCU in Houston, Texas, and the center was officially launched in February of 2021 with an initial $1.25 million grant from Houston Endowment. We just had our inaugural Bullard Center Gala on Saturday evening, and we honored Elizabeth Love, who gave us the initial $1.25 million startup grant. The Bullard Center is housed in the Barbara Jordan Mickey Leland School of Public Affairs. Our faculty appointments are in the Department of Urban Planning and Environmental Policy. And the Bullard Center's primary mission is really to confront systems that create and perpetuate environmental, climate, and racial injustice. We have 5 pillars, and that's kind of the basis for how we do the work in the Bullard Center. So they are education, training, and mentoring. And so that's where we mentor and provide training for undergraduate and graduate students. Research and policy, and so that includes all of our projects focused on air, water, disasters, civic engagement, civic and community engagement. And so much of that is the work that we do collaboratively with communities here in the Houston area and along the Gulf Coast as part of our
Is there
various
another one, or do
consortiums.
you guys want to start the puzzle?
Uh-oh. And then we provide technical assistance and support. So we do rapid response work, often in response to disasters or a situation where there may be like a recurring flooding that's happening caused by transportation. And then we do what we call networking and communication. So providing opportunities for HBCUs and community-based organizations to come together. So, in the Bullard Center, we work on air, water, and soil, and that looks like community air monitoring with our groups. Several of them are here joining us today. That also includes water sampling. We do lots of climate work, given that we're along the Gulf Coast. So, working on disaster preparedness, response and recovery, and extreme weather events, both heat and cold now. We also are doing work looking at energy, so liquefied natural gas, LNG, and solar, as well as transportation, particularly focused on looking at transportation-induced flooding. We are looking at community efforts focused on food security, housing, so healthy homes, and then health equity, so really understanding asthma and cancer clusters, maternal and infant health. And then we have an HBCU Climate Change Consortium, so that consists of over 35 HBCUs across the country. That's a faculty mentor at the university, as well as students that might be doing research or being mentored by that faculty member, as well as our HBCU-CBO Gulf Coast Equity Consortium. And so that work is done in Houston, New Orleans, Gulfport, Mobile, and Pensacola. We just finished doing health surveys, a health and resilience survey, in 8 communities as part of this Gulf Coast Equity Consortium. And so, other things that we're doing are workforce development here in Houston, where we train and underemployed individuals on career So, uh, So, of surrounding communities. So the Warren County protests also led to the Commission for Racial Justice to produce a seminal study called Toxic Waste and Race. And it's the first national study that correlates waste facility sites and demographic characteristics. It was done in 1987 and then repeated again in 2007 with the same results. Race was found to be the most potent variable in predicting where waste facilities were located, more powerful than poverty, land values, and even home ownership. Dr. Bullard is an author on both the 1987 and the 2007 study. In 1990, Dr. Bullard wrote a book, Dumping in Dixie, Race, Class, and Environmental Quality. It chronicles the convergence of two social movements, so social justice and the environmental movements. And the book highlights African Americans and environmental activism in the South, which is the same region that we think about when we talk about the civil rights movement. So, what really started out as local and often isolated community-based struggles against toxics and facility siting has now blossomed into a multi-issue, multi-ethnic, and multi-regional movement that we see across the country, across the world. And this book, Dumping in Dixie, is often used as the textbook for environmental justice classes today. So if you have never read Dumping in Dixie, I encourage you to purchase it. It's a fairly quick read, but very informative. So let's talk a little bit now about some of the Houston EJ problems. I'm going to share a little bit about some of the research to action projects that we do in the Bullard Center. I know some of my collaborators on these projects are here joining me today. We're going to talk about air quality. We also are going to talk about some of the cancer cluster work that we do. And then we're going to end, I think, talking about the lead work that we do. So air quality in Houston is certainly a problem. The American Lung Association's State of Air 2026 report says that in Harris County, which is comprised primarily of Houston, we get an F when we think of ozone. We are labeled with a D for 24-hour particle pollution, and for annual particle pollution, we receive a failing score. Unfortunately, the populations at risk are predominantly those who are considered low income and people of color. So there are over 5 million people living in Harris County. And of the 5 million people, about 1.2 million people, of the 5 million, about 1.2 are children under 18 that are at risk. 65 and older, about 600,000 are adult seniors. And when we think about pediatric children with asthma, about 91% are at risk. We see much more when we think about adult asthma, COPD, cardiovascular disease, and then you see at the bottom of the table about a little over 760,000 people who live in poverty are at risk, and 3.7 million people of color are at risk. So our people of color, low income children and seniors are really at risk when we think about the poor air quality that we face in Harris County. This image shows you where facilities are located here in the Houston area. So this is an image from EPA's Toxic Release Inventory tool, and the darker the color means that you have more people who are living in low income homes, and the dots that you see show you the total releases by facility. So the bigger the dot means you have more releases by facilities in those areas, and the darker the color means you have more people who have lower incomes. And what you see is low income communities have more facilities with darker colors, so there are more releases from those facilities. So you see facilities across Harris County, but you see darker colored facilities in people of low income communities. The other thing that I want to point out to you is that there's a kind of a white arrow to the left of Harris County. And I want you to remember this white arrow because we're going to see that again. So this image shows you respiratory illnesses and cancer risks from air pollution exposure. If you haven't had a chance, I encourage you to go to the Environmental Defense Fund's U.S. Climate Vulnerability Index website. This site is publicly available. It's really easy to use. Many of us were able to assist with helping them to kind of figure out how to make sure that it was user friendly, that the data was indicators that many of us needed to use when we're trying to share information, or that our community advocates were able to use when they were trying to share information with elected officials. And so you can see that the images are, the color schemes are great, but this one shows us toxic air pollutants in terms of respiratory illness, and on the right it shows us cancer risk. And so basically, the vulnerability that we see, the darker the color, the more vulnerable you are from air pollution for respiratory illnesses, to the right for cancer risk. And so remember that on the right sides, we're seeing on the east part of our Houston area, we see more issues related to respiratory and cancer risks. This image shows us the number of adults diagnosed with chronic diseases. So once again, we see the darker the color, the more vulnerable these communities are when we think about chronic illnesses or chronic diseases. And remember, we talked a little bit earlier, you kind of see the white arrow once again to the left. This one shows us the prevalence of air pollution related chronic diseases. So asthma, heart disease, diabetes, stroke, and COPD. You see again the white arrow, and on the right side, so in the east part of Harris County or Houston, Texas, once again we see we see the prevalence of air pollution related chronic diseases. So more chronic diseases on that east end of Houston. And then this image shows us access to care. So the availability, affordability, and the closeness or proximity to health care in our communities. And the same image unfolds. On the east or the right side of Houston or Harris County, we see more vulnerability or less access to health care. This one shows us access to health insurance. And then on the right side, it shows lower life expectancy. So the yellow dots show us where those toxic release inventory facilities are. The blue color shows us where a lack of health insurance exists. So the darker the color means less health insurance. So residents have less health insurance. So you can kind of see that where we see more facilities, we see less residents with health insurance, and we still see that white arrow. On the right image, we see this one focuses on lower life expectancy. And so the darker colors means you have lower life expectancy. And that image, once again, is on the right side, so on our east part of Harris County. And we still kind of see the white arrow where we see higher life expectancy in those areas. So what I don't want you to do is leave thinking that air quality is really horrible in Houston, and there's nothing to do that we can do about it, because we have some wonderful groups working in Houston to address air quality. They have been developing community air monitoring networks. They're doing great work working with local and public health officials. They are fighting permits every day for new and existing facilities that are harmful to their communities. They have new TCEQ regulatory grade monitors that have been installed in their community. And data is now, this was a couple of weeks ago, data is now available, and they've been awarded EPA air monitoring funding. So this flyer was from a meeting earlier in the year, last year, where we were sharing information from one of their air monitoring meetings. And this kind of shows you what their real-time air quality data looks like. So I actually took this from today, where air quality was moderate. They have low-cost sensors that are owned by their community-based organizations. Some of them are for doing phenomenal work on air quality. They're measuring PM 2.5 and volatile organic compounds, both in stationary and mobile air monitoring. and just doing really amazing work. So I wanted to make sure that everybody was aware that they are doing this work and making sure that their communities and their elected and public health officials are aware of what air quality looks like. So the next thing we'll talk about is a creosote exposure project that we've been doing for now a little over 6 years. So the City of Houston Health Department began working on a historical site that was owned by Union Pacific Railroad that resulted in soil and groundwater contamination. In April of 2019, a community group, Impact, expressed concerns about health impacts of living in close proximity to this contaminated site. So in November of that year, the Houston Health Department learned that an analysis was being done by the Texas Department of Health and Human Services and found that there were elevated counts of cancers known to be associated with the actual chemicals of concern, so PAHs that were found at that Union Pacific site. And the specific cancers were leukemia, esophagus, throat cancer, liver, lung, and bronchus. And so we confirmed that there is an adult and childhood cancer cluster in this community associated with this specific site. And so you'll see here the red part in the middle is actually the site, and the census tracts around it show you where the different specific cancers are located that are fence lined to the actual Union Pacific site. The unique cancers are associated with PAH exposure, and there has not been a whole lot of work done to really understand kind of how far, I guess, how widespread the exposure might be. So creosote is the actual contamination. The creosote is a substance that's widely used as a wood preservative. It can be hazardous to your health if you're exposed to high levels for a long period of time. It's mostly used to preserve wood for railroad ties and bridges, for fence posts, and often it used to be used for poles for like telephones and electric wires. It keeps the insects from basically destroying the wood and increases the life of those wood poles. So we know that EPA and IARC have both demonstrated that exposure to creosote may cause cancer in humans. So an investigation was started in November of 2023 by EPA. And from November to March of 2024, Union Pacific was forced to complete a round of sampling to really investigate residential soil, vapor intrusion, background soil sampling, and they also did some stormwater investigation. The residential soil sampling, vapor intrusion, and stormwater investigation all happened after the background soil sampling. And all of the sampling has completed and ended in December of 2024. So I think that's really what this one says. Yes. So this kind of shows you where the background soil sampling occurred. And the green stars show you where the concentrations did not exceed the EPA screening level. Unfortunately, the yellow stars show you where we did see exceedance of EPA screening level. So these were the background samples that then suggested that it was important to do and to kind of define where the residential soil sampling needed to happen. The red boundary shows you the outline of where the contaminated site is. And then residential soil sampling occurred, and that sampling happened in zones. So it happened kind of in different phases. And you can see here it happened in phases at different times. All of the sampling is completed. And at this time, all of the residents have been informed of if their samples exceeded the EPA screening level. So in zone one, 9 of the 27 samples that were taken exceeded the EPA screening level. And you can see here which chemicals were screened. So dioxins, benzoylpyrene, and then in zone two, you see that 11 of the 49 samples exceeded the EPA screening level. And looking at the range of exceedances, some of them exceeded those screening level values by even threefold. So we saw some pretty high levels of dioxins and benzoylpyrene. Zone 3 showed very similar results. So 11 of the 59 samples were seen in zone 3, and then 6 of the 35 were seen in zone 4. So 26% of the homes, the residential soil samples exceeded the EPA screening levels or screening values, and some of them by threefold. So at this point, the EPA, so this all happened by mid 2025. And with the changes in our administration and EPA leadership, we have not seen the same response from EPA. So we actually met this month to kind of talk about what that response looks like and what do we say to residents who are very concerned about their soil samples and their samples exceeding the EPA screening level. And so we can have some conversations about what that looks like and how best to talk about it with residents. And so these are just some examples of the kinds of one-pagers that we put together, and also flyers from some of the community meetings that we've hosted where we've brought in people from the health department and EPA, as well as elected officials, people from Environmental Defense Fund, the actual company, Union Pacific Railroad. So really trying to come in and make sure that we can answer questions for community members and residents. I think we have a few more. So our last top exposure today is going to be about lead. So some of the lead work that we do is done also very collaboratively with communities, and I want to share a little bit of that with you. So, lead is a naturally occurring toxic metal that was used for many years in products found in and around our homes. It can be found naturally in soil, but more commonly found in human-made products. We used it in paint for decades. Many of us remember lead and unlead. We remember lead and unleaded gas. Industrial sites we often see with lead. And then places that process and recycle or use large amounts of metal. So those metal recycling facilities that we see in our EJ communities. There are no safe levels of lead, but higher concentrations are definitely more dangerous. And those that are most at risk are children, generally 0 to 6 years of age, and pregnant. Women who are pregnant are women who are trying to become pregnant. So, in this Fifth Ward community, homes built before 1978 may have lead in them. And we know that there were over 44,000 homes in Fifth Ward that were built before 1978. So, about 50% of their housing stock basically was built before 78. The lead exposure from paint chips, water, and dust we know poses serious health hazards when we think about pregnant women and children. The Houston Health Department had funding from the U.S. Department of Housing and Urban Development, so HUD, to reduce lead-based paint hazards. And they were really trying to use this funding to come in and do lead abatement projects in various homes. And so our groups, our collaborative groups, worked with the health department to identify homes and figure out a way to reduce lead exposure for children in this community. So one of our collaborative groups, COCO, has a block captain initiative. And so they do all kinds of things from conducting outreach to working on CBPR projects. They worked with us to survey homes for lead exposure. They assisted me with collecting water and soil samples and then educated residents about lead exposure. They also did some work organizing food distributions and work during COVID and all kinds of vaccination and testing. This is a flyer that they use to really begin to educate residents about lead exposure and survey their homes. So from the pilot study that we did in lead, that we did looking at lead in drinking water, and it was particularly from kitchen taps, lead was detected in over 30% of the homes in that study. And over 14% of the homes had greater than 1 parts per billion of lead in their kitchen tap water. The highest amount of lead detected was 22 parts per billion, and the EPA has an action level set at 15 parts per billion. So that was pretty high, and we really made a point of making sure that we sent letters to make sure people understood that we detected lead in their drinking water. We also scheduled meetings with them to educate them about lead exposure and what it meant for children and pregnant women. And we provided water filters that filtered out lead in drinking water, specifically in their kitchen taps. So really working with them to understand what that lead exposure looked like. The other thing we did recently was to look at lead in drinking water in elementary schools in Houston Independent School District. So this data is no longer publicly available, but I had a student in the fall semester of 2025 who was able to download the HISD's data. It was on their website, and in 2024, they retested all of their schools to look for lead in drinking water in water faucets, kitchen sinks, bathrooms. And so we were able to take the data and then map it and look at income, people of color, and lead concentrations. And so what you see here is the dots are actually the green dots, or the concentrations of lead at schools. The blue color shows you where people live with low incomes, and the pink color shows you where people of color live. And so the take-home message is the blue colors show more people with lead schools in them. So schools that have lead in drinking water, whether it be in their kitchens or their drinking faucets. And oftentimes, schools in our communities don't have water bottle filling stations and ways of eliminating lead in drinking water. So I think the other thing to point out is the white arrow exists once again. So often, we do these maps, and it's unfortunate that we show you various exposures and health outcomes, and no matter what we do, this white arrow exists and shows you that people of color in communities are impacted often more when we think of exposure, when we think of health outcomes, and when we think of limited access to health care. And this is another example of that. So our children are attending school and unfortunately being exposed to lead and higher concentrations of lead, and not necessarily having an opportunity to access healthcare to address these lead exposures. So this was a student project, and I just thought it would be good to highlight that. So, what can you do? I think it's important for all of us to understand the relationship between health and environmental exposures. Understanding health outcomes and very things like asthma and respiratory diseases and cardiovascular disease. So, oftentimes we have chronic illnesses and things that we might go to the doctor or we may um, treat them on our own, and never think that they're associated with some exposure that we may have or because we're living in close proximity to some industrial facility. Unfortunately, in the Houston area, we don't have zoning. So we have industrial facilities that are just dispersed throughout our communities. We have metal recyclers and concrete batch plants and paint shops and all kinds of warehouses where things are stored that we don't even have a record of. So it's really important for us to begin to think about where we live, what we're exposed to, and how it impacts our health, and to become an advocate for those things. So that looks like you getting involved in your neighborhood or your civic organization, or maybe an organization like your physician organization, working through your school or a work-related organization. And then on a community level, working to create things like deed restrictions or restricting industrial contaminants in your area and bringing these issues to the attention of local officials and other community leaders. Sometimes local officials have no idea that a company is operating in their district. And so, really pushing them and letting them know this is what's happening and I need you to assist us and, represent us, help us to fight this permit so that this company can't expand or they can't move into my neighborhood. Really becoming an advocate, joining other advocates, assisting communities, working with universities like us, and assessing environmental exposures and understanding risk, and helping with communicating strategies. So sometimes it's really difficult to explain exposure and health. And so having physicians to be able to help us to create like slide decks or infographics and things like that to explain those associations, those kinds of projects would be extremely helpful. And then I think that's it. So I can't see the chat, so if someone can help me with the chat,
We can
I
do
am
that.
happy to take any questions.
Excellent. Let me see if there are questions. Do you see any, Drity, in the chat box?
Oh, here, now I can see the chat.
I cannot.
Okay. So I don't want to
I have a
hog up the
question,
time.
Dr.
Does anybody
Rose.
have any? Okay, sure.
Dr.
Please.
Jones, I have a question. Thank you, Dr. King, for this wonderful presentation. I've had the privilege to hear Dr. Bullard several times on some of these very issues, and I know his dedication is unmatched. I had a couple of questions. One, with the chemical from the Union Pacific, or the the remnants of Union Pacific being used. And I know you had a flyer there with a community information sessions that you had. Was Union Pacific invited? Were they a part of that?
Yes, they were always invited, and generally they attended.
How did they respond?
They were not the most responsive, but they were required to.
Oh,
Yeah, so EPA required them to participate.
I see.
They did. They required them at the time. That
Okay.
probably is not true today, but at that time, they required them to participate and they required them to pay for the testing.
Okay.
So I didn't say this, but we had I call it the perfect storm.
Hmm.
So the director of the EPA, so the administrator of the EPA, decided when he became over the EPA, he wanted to tour the areas and learn about the various environmental concerns. So he did a journey, he called it a journey to justice tour. And he came to Houston, and we were able to take him to the various communities so that he could see what in EJ looked like in our area.
Mhm.
So we took him to that very community. We actually took him to Fifth Ward. He was able to speak with residents and learn about this contaminated site.
Mm.
And then our regional EPA director, so our Region 6 EPA director was on the faculty at TSU. So she had previously worked with us and was a colleague. She knew all about the contamination in Fifth Ward. So we kind of had the perfect storm when we think about that situation. They were perfect for forcing um, Union Pacific to really consider this contamination and to
Right.
do the testing. I don't know that it would have happened had they not been
Yeah.
in those positions. That's really the truth.
Well, one of the things too with EJ, I think is really important for all of us who have have privileges and have resources to be in that space where a homeowner knows that there's some contamination, but they don't have the resources to
Mhm.
just move, as some of us would do that. And so I think it's always important to remind people of that. You can't, everybody just can't move. And, again, just a very, very important thing to mention. And then the
Yeah.
last item, when you were talking about lead, and you had the map of the school up and you kept referring to the white arrow, I kept
Hmm.
looking around for a white arrow until I
Oh, you didn't see
realized
the
it was
white
right in
arrow?
front of me.
Oh,
So I thank you for that. I had not heard that before.
yes, that white arrow is pretty persistent when
Yeah.
we show maps in Houston.
Yeah.
And it basically is I guess the former energy corridor, so like the Katy area of Houston.
Hmm.
That's really where it is.
Yeah, I see. Yeah.
Yeah.
Again, thank you so much for the presentation.
Oh, you're welcome. Thank you.
Any other questions? I'll jump in then really quickly. I'm really curious, if you can share, I mean, the geopolitical environment that we're all now living in, is been devastating. I mean, I'm a consultant. I work in the space of public health, climate, and equity, and it's pretty much been damaged in significant ways. So I'm wondering from where you sit, what's been the major impact and what is your major concerns moving forward?
Hmm. Um, I think it's going to take us many years to recover from the changes that we're seeing right now. So just from a regulatory perspective, all the rollbacks when we think about enforcement and changes, those things are pretty devastating. It's going to take us a long time to get back to, or to, yeah, just to get back to where we were. Um, I think that the other thing is that we've lost data. And so that, yeah, I know we've lost data. And we're every day you figure out, oh, we've lost some more data. So when I was trying to do something with this map, my student told me that last week. She said, "Oh, the data's not there anymore." So you're constantly realizing that you've lost data, so you can't do comparisons when you lose data. So
Mhm.
data is a big problem. The rollback of regulation is certainly a huge problem. But we have really tried to stay encouraged. The work that I do with my colleagues, so Dr. Walker, Miss Joanne Burbridge is on this call, Miss Melanie, we get to work together with communities to really think about what's most impactful. And I think, just taking the time to stop and think about it, it doesn't always have to be some major um, we lost a lot of federal funding, and I have to say that too.
I wonder,
But it
yeah.
doesn't always have to be this major federal funding for the work to be impactful. And I think remembering that has been important for me. But it is a very difficult time right now when we think about environment climate and public health. We are in that space, and this is not the best space to be today. But this work has to happen no matter what, right?
100%.
We have no option. We have to do this work. So we just have to continue to be encouraged. We have to know that communities need us, right? We have to know that when we work in public health, we are required to do this work so that our communities, our country, that we are able to think about it for the good of everybody. And so there's no option but to do the work. When we think about climate, disasters are coming. They're coming left and right. They're not going to stop just because somebody says climate change isn't real. We have to do this work because we experience on the Gulf Coast, we experience these disasters frequently. We know that they're real. We know that it's hotter in Houston. We 2 summers ago, we had 60 days of 100 degrees. We know what that feels like. So we know that these days are real. We know that people suffer. And we know that lower income and people of color suffer more when we think about heat and cold and disasters. It's harder for them to recover when we have disasters and things like that. So it
I
is a
appreciate
tough time. Yeah, it's a tough time, but we have no option. We have to do this work.
I appreciate that. Thank
You
you.
know, you know, and that brings Dr. King, what you're saying. First of all, our first annual Heat Summit is on Thursday.
Yeah, they were telling me
Dr.
that.
Jones will be our keynote speaker. So Becky, maybe you can put the link in the chat. But the other thing that we're talking just now reminded me of the power that people have.
Hmm.
And the more you do inform the community, the more you let them know what actions they can take, reaching out to their policymakers, voting.
Hmm.
I think whatever may happen, you can't take that away from people, the power, and just for people and communities to recognize that and to act upon that as well. So thank you for reminding us of that.
You're welcome.
Wonderful.
Um,
Okay.
Dr. King, oh, is it okay if I ask a question?
Absolutely.
Okay. I'm just curious if there have been any conversations in Houston. The only city that I know of that's really done this is Phoenix, of academic institutions, community organizations, and the city and county public health departments working together systematically on a strategic extreme heat plan.
Not specifically on a heat plan, but the climate action plan here in Houston, yes. But it
Okay.
wasn't specific for heat. But yes, the climate action plan, absolutely.
I will take a look at that. Thank you.
Yes. And it was really spearheaded by SEER, Commu Coalition of Environment, Equity, and Resilience.
Is that a local group, Dr. King?
It is. It's a local group that was started after Hurricane Harvey. So in 2017, after Hurricane Harvey, many of us came together and realized that we needed to kind of figure out how to pool our resources and our power. That was really the truth. We needed to get a bond election.
Mm.
So we actually met in the at TSU on the fourth floor of our building. We did. And we started SEER, and that organization has done amazing work. They do weatherization and after storms, they make sure that they set up like office hours so people can come in and get access to resources. They do all kinds of work. So really good work, and they kind of spearheaded most recently the climate action work. They're a good group to kind of look at they partnered with our county commissioner, Rodney Ellis. And that's the one example that I can think of that I feel like was a really good example of all kinds of different groups coming together. But it's a climate justice plan, not specifically for heat.
Any other questions or comments? Well, we are very grateful. I found it very, very informative and inspiring. I love
Oh, thank you.
your can-do attitude. It's hard in these times, but I really appreciate the information and your team being here to support you. I will follow up with you tomorrow and send you that medical students op-ed. It's amazing. I think that you'll be able to put it to good use with your group.
Well, thank you. Thank you. I
So
look forward to reading it. Thank you to my friends for joining me.
good night, everyone. Thanks for joining
Good
us.
night.
Take care. Bye-bye.
Bye-bye.
Good night. Thank you.